hospital incident that occurred over the weekend has sparked another national conversation on healthcare delivery, and that's what we are going to focus on here tonight on PM Express. We are looking at healthcare, access to healthcare, and the rights of patients. Over the weekend, a lot happened at the Greater Accra Regional Hospital, and we all know what is going on. The Ministry of Health has spoken, nurses have spoken, doctors have also spoken. We've had the side of the story of victims, including nurses and all those who were involved. That is what we are going to focus here, but we are going to extend the conversation, not just on what happened at the Greater Accra Regional Hospital, but look at healthcare in general in this country and use that as a test case to know what is actually going on. Is this just a tip of the iceberg in terms of what we are seeing across the length and breadth of the country? Of course, there's precedent. There's a lot that has happened over the years, and it is not something new. Almost every year we have, one or two of such incidents. So what do we know so far as the current issue is concerned? We all know what happened over the weekend, and the response from the health ministry has been that, look, they are actually going into this issue. And what they are saying is that there is some form of reported or alleged delay in the treating a certain critical injured patient that actually caused the whole incident. The ministry says that they are looking at that. The nurses have actually also responded, the hospital itself, saying that, look, the emergency area is not one area that you just go there and get, healthcare. In fact, if you look at the system that they have and how the situation was over the weekend, they say that emergency unit was busy attending to other cases. And that is what we have in terms of the story so far. But we'll extend the conversation and look at what the health minister himself has been saying. He's been speaking to Joy News. And what do we know so far? He said that, look, the issue is a pressing one. So they have gone ahead to solve it immediately. And what he's saying is that there's been a 5-member committee that has been set up, and he mentioned those who are involved. There's an HR involved, there's a lawyer involved, a doctor is involved, a nurse is also involved. And so you have that 5-member committee that is expected to look into this matter. But beyond that, he's saying that they've moved ahead, or they've gone ahead in terms of, they've gone beyond setting up a committee. They've secured the area, they've reinforced security in the hospital, and they're saying that calm has been restored, and that is the kind of situation we have currently. Beyond that, there are big questions about arrest, because we all know what the Ghana Registered Nurse and Midwife Association have been saying about their target, Saint. They're saying that he should be arrested, and the minister has been saying, speaking and saying that some arrests have been made. We don't know the details of those who have been arrested so far, but what we know, and per what our checks, shows that Raf is still, a free man, and according to the nurses, he is the person they want arrested because they believe that he played a significant role in what happened over the weekend. But the minister says that, well, we are not sitting down idle because some arrests have been made so far. Beyond that, what makes this important is that the Ghana Registered Nurse and Midwife Association are saying that, look, we have given government a 48-hour ultimatum. And what do they want? They want the police to arrest the victim. 48 hours, which the statement came out yesterday. We're expecting that by tomorrow, that 48 hours should elapse. And it will be interesting to see what the association would do if government or if Raf doesn't get arrested. What would the Ghana Registered Nurse and Midwife Association do? They will be on this show. We'll be asking them the questions. What will be their steps or the next step that they'll follow if they don't get what they want, or this ultimatum that they have actually issued is not met. But I was telling you that this could be just a tip of the iceberg. We are looking at healthcare, access to healthcare in the country. What do we know so far in terms of, based on what the hospital administration have been saying about the fact that the emergency unit was busy at that point, and they were actually inundated with a lot of cases around that time. And so we need to look at the national picture and to see what is actually happening across the length and breadth of the country. If you look at the current picture of the country in terms of healthcare delivery, about 1.8 nurses for every 1,000 population. If you want to bring it home, the nurse to patient ratio is somewhere around 1 nurse is to about 600 patients. That is what we are talking about currently. And so definitely that statistic actually explains what you see when you walk to the various government hospitals and you see the crowd, because we have a big gap to fill. Why? Because you have 1 nurse currently serving at least 600 patients. And the situation is terrible. We are talking about the average situation. But if you go to the hinterlands or other parts of the country, not even the capital or the cities, this issue is actually worse. Not just the nurses. If you actually move a notch higher and look at the doctor ratio as well, 1 doctor currently is serving about 4,333 patients. That's the situation we have. So you have the nurses themselves, overwhelmed with a lot of cases and patients. 1 nurse serving about 600 patients. 1 doctor also serving over 4,000 patients. And so definitely you can see that the current population of healthcare workers we have in the country are doing their best, because their numbers are woefully inadequate. In fact, meeting global standards and what have you. This falls below global standards. And moving beyond that, yesterday the minister spoke to Joy News, and he made this interesting revelation, or rather shocking revelation, that in as much as we have some big issues where 1 nurse serving about 600 patients and 1 doctor serving over 4,000 people, we still have some 70,000 health professionals or health personnel who are sitting home idle, and they are not employed. And this is simply because of the fiscal position of the country. And he said that if you ask me about whether financial position of the country is really contributing, I'll say is a big or a significant factor in here. So whilst we are having this big challenge on our hands, it's not that we've not trained people to actually fill the gap. We've trained them, but we don't have the budget to actually rope these people in terms of the healthcare delivery. And so you have about 70,000 healthcare professionals, including nurses, doctors, allied health professionals, all sitting at home, not employed, not because they don't have the qualification, but because government cannot find the budget to actually rope them into that labor force. And of course, this for me is the bigger picture. Why? Because it will help you understand the status of our healthcare delivery and even expenditure and funding our healthcare delivery. Why this picture is important is that if you look at between 2020 and 2025, in terms of budgetary allocation, we are looking at some close to about 75 billion Ghana cedis that has been allocated to as health budget. And I've been saying that if you look at the areas we spend as a country, if you take away education, which is always number 1, health is the second, before you talk about defense and energy and what have you. But out of this, close to about 70 billion we've actually allocated to healthcare delivery over the years, over a period of 5 years. It will be, you'll be shocked to know that about 63% of that has actually gone into just payment of wages and salaries, right? So in some instances, we spend more than even 80% of our healthcare budget just to pay workers. So you ask yourself, how do we fund for capital expenditure? How do we buy new MRIs? How do we buy new CT scans? How do we buy new equipment to actually, enable proper healthcare delivery or healthcare, people to get access to healthcare? Where we have allocated about 75 billion Ghana cedis for healthcare, but about 63% of that has gone into the payment of wages and salaries, leaving just a few for other things like goods and services and capital expenditure. So it is important to also put this across, because whilst we are complaining that we don't have the budget to absorb people like the 70,000 health personnel who are sitting at home, or according to the minister, even with the nurses, you have the 2021 batch unemployed sitting at home, 2022 batch sitting at home, 2023 batch also sitting at home. And the current 2024 batch who will be exiting soon will also likely sit at home. And so the question is, if we can't bring them into the labor force, or we can't employ them, why do you keep trading them? And another big question is, you spend close to about 2.5 billion Ghana cedis as nursing trainee allowances. And we have done the math, and the average is around 444 million Ghana cedis every year that we spend on nursing trainee allowances. And between 2020 and 2025, this is the amount we have allocated to nursing trainee allowance so far. So we pay people to go into nursing, and when they are done, we cannot employ them. Or when they are done, they have to sit at home for more than 5 years, 6 years. So eventually, when you even employ them, they've sat at home and they've become rusty. How do they practice while they are sitting at home or while they're staying at home? And if we have such an amount of money to be paying allowances, many are asking that, why don't you channel this as a budget and employ more people? Because this year, the estimation is that we could spend about 777 million cedis as the payment of nursing training allowances. That, for us here at Joy News, with our calculations we've done, shows that if you have a decent package, you could possibly employ more than 9,000 nurses with that budget. Don't pay them the allowances. Many are saying that don't pay them the allowances. Use the budget for the allowances to rope in more nurses, to employ more nurses. Why? Because this is your situation where even this year, you are hoping to expend some 17.8 billion cedis on healthcare budget. But just look at it this way. Your employees will take 73% of that budget. Then you come to goods and services. Healthcare, very, very important. Goods and services, so important. You're spending just 20% of your budget on goods and services, leaving 6.2% for capital expenditure to build new hospitals, to buy equipment, and all of that. So what we have noticed is that in years where we've not benefited from donor programs and grants and loans and what have you, we struggle. And we go ahead to do all forms of programs to build new infrastructure and all of that, but funding is important, and we end up abandoning them. So that is what we are going to focus here on PM Express. What happened over the weekend is opening the can of worms, and that is why we are having this conversation, looking at the whole situation with a 360 view. Look at healthcare delivery, access to healthcare, and the rights of patients. The country itself, our healthcare budget, is in the right direction. What are we supposed to do? Are we supposed to take out the nursing training allowance and use that budget to employ new nurses so that we will not have instances where people go to the hospitals and they complain about being attended to in a very, very delayed manner or period? Of course, that is what we are going to focus here on PMS.